To demonstrate today a new piece of technology we bought at Palmer Distinctive Dentistry. It's called a Diagonodent. It's a laser caries detector. And the purpose of this is to detect cavities in teeth before they get big. We can restore them when they're smaller, save them on tooth structure, having less chance of the tooth giving problems down the road. This is Jenny in the chair. She works for me. Jenny actually has not had a lot of cavities in her career. And we use this on her, and we were kind of surprised to see some teeth to have some high numbers. So I'm going to show you how this thing works. You will hear it making some noise. Little high peaks. And we're getting some numbers. That tooth gave us a number of 69. Now when it's around 10, there's decay present, and when it gets maybe 15 to 20, the decay is all the way through the outer layer of the tooth. So at 69, when we open this tooth up, we're expecting to see some decay. She's got a second tooth that really doesn't, it's got a little stain in it, doesn't appear to be decayed. We'll test it and get some readings on it. And it's at 26. So it should be a little smaller, but that's still supposed to be decayed through the enamel, the outer layer of the tooth. And see, I don't know if you can see in there and see the stain in that back tooth. Alright. So I'm going to go ahead and open these teeth up and see how much decay we got. So we're through the enamel, we're down to the yellow part of the inside of the tooth, second layer, which is softer, and you can see the stain or decay that is all the way through and getting into that part of the tooth. Now I'm going to switch to the smallest little instrument I have and just get the rest of that out, and we're going to be able to do a very conservative restoration. It should not affect the nerve of this tooth at all. Hopefully won't have any sensitivity. So the advantages of the Diagonodent are that it finds dental cavities before you can see it on an x-ray. But another advantage of it, it also tells us when we shouldn't treat a tooth. So for us in our office, when we find numbers that are above 10 but less than say 20 or 25, that's a good indication we should treat that tooth with ozone. Try to arrest that decay before it breaks through that outer layer of the tooth. When the numbers get higher, we know that that's an appropriate tooth to be treating and make the cavity preparation as small as we can.